Good morning, everyone. Let me know in the chat box if you can't hear me. Welcome to this presentation for the Reproductive Health Conference for Wisconsin and Healthcare Education and Training. I am honored to be with all of you this morning. So I want to actually start today. I know it's early and there's a lot going on in our world. So I just want to take a moment to acknowledge that. Obviously, many of you are probably in Wisconsin. I want to just take a moment and, send our thoughts to Jacob Black and his family. Blake, oh my gosh, I can't read my own. I'm reading my own handwriting. And anyway, Jacob Blake and his family. What a horrible way to start. I apologize. There's things going on with COVID, and of course, those in the South who are dealing with Hurricane Laura at this time. So I just, it's a heavy day. And I think by starting off by just acknowledging that it's a heavy day, and I am also going to be discussing a heavier topic. So I hope to make it interactive, and as we move forward, I just want to thank you for being here. So my name is Christie. I'm not sure if I said that yet, but I am obsessed. I'm a proud dog mom of 2 adorable pups. Dexter is on the left and Reggie is on the right. I like to introduce you to them so that, if they happen to bark, which they did literally 30 seconds before we started, you can put a face to the madness that's going on in the background. And it helps you learn a little bit about me. I love these 2. So I am from New York State. I live about an hour north of New York City. And I have two organizations. I'm a public health consultant. That's my main job. I do and provide professional training, training solutions, and also professional facilitation for nonprofits and public health entities. So I work with the government and a lot of health nonprofits or organizations. I also do curriculum development. And then earlier this year, I founded a project called How to Talk to Your Doctor. So here I focus on workforce development for healthcare workers, nurses, community health workers, social workers, caseworkers, on how to improve health literacy, health communication, to also improve the relationship between doctors and patients. I love this work. I also provide direct patient education through virtual workshops. Before COVID, I was traveling a lot, but it has been, I've enjoyed the process of providing virtual trainings and education and webinars much more than I thought I would, because I've always been an in-person trainer and I love interaction and facilitation. So I have enjoyed that transformation. At the end, there will be an opportunity for us to connect. I have a free resource for you. There's going to be 2 resources, one that's provided through the presentation, but then I have a freebie at the end if you're interested, and it will help us to stay connected as we move forward. So what are we going to be discussing today? I'm going to be talking about how racial health disparities disproportionately impact the most vulnerable during COVID-19. And then we're going to examine the organizational and local preparedness efforts in order to help nonprofits and organizations to really improve response, but through an equity lens. So this is really a three-part, 3-part, but 2 and 3 kind of go together, a presentation. So I'm going to start by, again, focusing on COVID and racial health disparities. Then we're going to talk about preparedness. And then we're going to talk about how do we move forward through COVID with, and being prepared, more prepared in the future through using this equitable lens. And I'm going to help walk us through some ways that we can discuss that and work for that going forward. So I don't have the polling option, but what I would like us to do is in the chat, if you could tell me. So here, I like to start with icebreakers. Even through Zoom, it's really good to, kind of keep ourselves engaged, right? So here's my question. If you could be a superhero, what power would you want? And I'm only going to give you 3 options. The first option is to fly. The second is to be able to read other people's minds, so read minds, or talk to animals. So you can just jot that into the chat and let me know, what would you choose? Would you want to be able to fly? Would you want to be able to read minds? or would you want to be able to talk to animals? Ooh, so far we have one of each. I like it. I'll give you a couple more minutes. Awesome. So I would also choose, I'm sure you've already realized just between, me introducing you to my dogs and also the picture here I'm using for my poll, that I would probably want to talk to animals. I would love, because I also have 2 rescue dogs. And when you have rescue dogs, you constantly wonder, like, what was their life like before me? I want to know. But I have to be honest, I use this poll pretty often with different groups. And normally the number one answer is actually read minds. I think that says a lot about our society. We want to know what other people are thinking, but obviously that's not the case with you all. So that's interesting. I always love doing this. Just a fun way to start us off. So I'm going to jump right into it from there. So here we're talking about the social determinants of health. And I'm going to explain what they are for those of you who might not be familiar. But the social determinants of health are the non-medical factors. So we see all of these things that don't necessarily have to do with our health directly, right? That impact our health. So our economic stability, education, food, where we live, and how much that impacts our health. One of the ways that public health folks and some doctors like to explain it is that our zip code actually has more of an impact on our health than our genetic code. So where we live has more of an impact on our health than our genetics. And that says a lot. So, and these are the categories that the social determinants of health are broken into. So there were obviously health disparities before COVID, no question. No, forever, there's been health disparities. But what COVID has done is really amplified and magnified the problems of these social determinants. So if we look across this chart, right, we see economic stability, or now instability, employment, income. All of these things have been impacted greatly by COVID-19. Housing, and we know that housing has many different impacts. So poor housing can lead to poor health outcomes, higher rates of asthma, for example. I'm going to talk about transportation in just a second. Education. I mean, come on, there isn't a hotter topic in around COVID right now, going back to school. I actually don't have children, but I do have a husband who's a teacher, and what they're requiring of him to do is unbelievable. And I'm going to talk about childcare in a few minutes. So food, we know that this food insecurity has been highlighted. All of these things have been impacted by COVID. So I just wanted to kind of give an overview of what the social determinants are, but then I want to dig a little deeper and look at some of them with some more depth. So we know that Black communities, Latinx, immigrant, Native American, have really had disproportionate, they bear the brunt of this disease, without a lack of better way to say that. On top of these already existing racial inequities that they have been faced with for decades. This isn't new. Code Switch, I don't know if any of you listen to podcasts. Code Switch is one of my favorite podcasts. And yesterday, their episode, I highly recommend it. They actually talked about this and how crazy it is that it took COVID, that so many people, it seems like I'm not saying the people that on this webinar, but in general in society, that it seems crazy that so many people didn't really grasp or understand or see these unbelievable health disparities, and that it took COVID to bring those to light. So I want to talk about structural inequities, even a few more in depth, as I mentioned. So we know that Black and brown neighborhoods, as a result of redlining, I'm not going to go into redlining because I don't have the time, but I do highly recommend this book, The Color of Law, if you're interested in learning more. Highly recommended. Folks face very deep disparities as a result of this high housing and homelessness. So we know that a lot of people live in small spaces, apartments, homes, and sometimes there's multi-generational families living in one home. So how is it possible, if somebody is infected with COVID, for them to self-isolate? There's only one bathroom, there's very small enclosed living spaces, or you have 2 or 3 generations of family living in the same place. How is that possible? So housing segregation, not only the location of where people are living, but also the circumstances in which their homes are smaller and not kept up, and all of these other problems that we see around this. Another problem is that a lot of folks are still essential workers. So telling them to practice social distancing is just not realistic. And the other thing that comes from housing, and this isn't always necessarily talking about segregation, but housing can also, people in rural areas, you're in the Midwest. So, having access to a car, being able to get to a grocery store, feeling, isolated and not having the means to go to the grocery store and buy a number of, 2 or 3 weeks of food because they don't have the economic means to do that. And also, if you're living in an urban area and you don't have transportation, that's a problem as well. I see Nikki just said that she just started reading The Color of Law. Yeah, it's a great book. So insightful. Thanks for sharing that, Nikki. Next, I want to talk a little bit about employment. And we see and we know that Black Americans make up about 13% of the US population, but they actually hold less than 3% of the country's wealth. So again, we know that minority populations in the country make up these disproportionately essential workers, grocery workers, healthcare professionals, public transport employees, custodial staff, and they can't afford to stop working. So it's not really an option for them when you say to quarantine or, what do we do about our kids? And I'm going to continue to go back to that, and I'll talk about childcare. And then the other side of the piece, or other side of the coin, Black adults are more likely to be exposed to greater occupational hazards, not having enough PPE, not being able to protect themselves. And then other Black folks are more likely to be laid off. So in many ways, they are being impacted economically by this pandemic. And I'm gonna just hold, because I'm actually have an entire slide about how women are being disproportionately impacted, which just adds to the employment crisis. And then I want to end with taking a closer look at these structural inequalities by just mentioning and highlighting the disproportionate incarceration rates. Black Americans are incarcerated more than 5 times the rate of white Americans, which increases their threat to COVID, of course, due to restricted movement, confined spaces, and limited medical care. But there's another side to this. There's that side of the community. So when large parts of your community are incarcerated, that has other impacts within the community. Single parents having only one income to take care of the kids and the pressure that puts on them. especially when we're talking about a pandemic where you possibly don't have access to childcare. What are you supposed to do? So there's more to the incarceration problem than just those who are incarcerated. It also impacts the communities in which they are from. I have a whole slide for, health disparities. And I want to just start with this historical distrust. There are many, many reasons that people don't trust the medical system. And I actually have an entire presentation on this. So if you want more information, feel free to reach out. I'd be happy to work with you. But just to give a couple of examples, Tuskegee study that studied for 40 years African-American men who had syphilis but were told they had bad blood. And even when a treatment became available, they weren't offered the treatment. And there's so many other examples, unfortunately. Another book I recommend is A Medical Apartheid by Harriet Washington. She talks in great detail about these unethical trials that have gone on for hundreds of years, primarily with people of color and specifically Black communities. We also know there's bias in healthcare. This is no surprise to anyone. Most of us in our lifetime will deal with some sort of bias in healthcare, but people of color and those who have intersecting identities are more likely to experience stereotypes and discrimination in the healthcare system. And what I mean by that is if you are a Black, gay, disabled woman, the more likely you are to experience the discrimination and bias from medical providers. We have a lot of work to do. And I just want to stress that when we talk about bias in healthcare, there is no quick solution. These 7-hour day checked boxes trainings are not enough. We need more. Also, of course, these pre-pandemic disparities that we talk about through the social determinants of health, those determinants were there before. This isn't new. And we also know that just when we talk about health conditions, that their pre-existing conditions are also disproportionately impact the Black community. So they're more likely than whites to die of cancer, chronic pain, diabetes, infectious diseases such as HIV, and so on. So there's a lot of work to do. Health insurance coverage, expanding Medicaid to make sure that it is covered in all states so that people have access to the care that they need. And then also, of course, language barriers. But I'm going to get to language barriers in a little more detail and use telehealth as an example of how we're seeing a problem with language barriers during COVID-19. So women have certainly been impacted by COVID. They're being left behind, particularly Black women. Parents in 2020 should have choices around childcare and where they work and when they work. But what kind of choice is it when women are made to choose between feeding their child and putting food on the table? And putting food on the table and working. I'm sorry. I had an email come through. You know how that happens? And you're like, oh, I shouldn't have looked at that, but it came through. Anyway, so what I'm saying is, of course, it's always at those times when it's like you're saying the most important thing. Women, when they have to make the choice between putting food on the table and going to work, they're going to have to go to work. And leaving their child in possible inadequate care, it's not a choice, is it? It's an unbelievable burden on women in particular. And I'm going to talk about men in a minute. And parents in general. Of course, it's not just women. We have, we have modern families today, and partners. So I'll mention that in a moment. But the Washington Post warned that the childcare crisis could set women back an entire generation based on job losses, earnings, childcare, workplace hostility towards women who have to stay home so that they can educate their children because their children can't go back to school. It's just this unbelievable place that we're putting people in right now. It's just there's a no-win situation. One stat that I also want to share from that Washington Post piece, though, that I thought was just really, it shows this disparity even more so, is 67% of Black women have had the most concern about paying their mortgage or rent, buying groceries, and covering other basic necessities during COVID. So 67% of Black women versus only 29% of white men. That's a huge disparity. What we need is universal childcare, and we needed it a long time ago. We need to give parents, all parents, the freedom to choose what works best for them. Women's working hours need to be valued in the same way as men's, and we really need to start focusing on that. In a New York Times article a couple of weeks ago, fewer than 1/3, so about 33% of men say that they're fully responsible for childcare. Only 1/3. So what we need to do is, make sure that we offer flexible schedules. We continue to offer remote work, on-site childcare, and also policies that include men as well, so that we can address gender roles versus reinforcing them, which is what we're seeing through COVID-19. So I want to share this, a couple of examples, something we're hearing a lot about during COVID that you might not hear so much about in the media, and also topics that are just vitally important. So when we talk about policy mechanisms through testing centers and strategies, first of all, most testing centers are in affluent areas. They are drive up. And many require a doctor's order. So that's a barrier. What if you don't have a car? If you're in an urban area and you don't have a car, or what if you live in a rural area and you have to drive an hour and a half, 2 hours to a testing center, and then you wait in line and sometimes the tests run out. So there are many barriers to getting tested. And then the CDC, if you didn't notice, it just came out yesterday, is starting to say again that they only want to test symptomatic carriers. What? Like, this is not sound science. We've already seen many, many doctors and public health officials pushing against this. We have to be testing, symptomatic or not. Testing it's basic to following the COVID pandemic and knowing where we have breakouts and where we don't. It's kind of unbelievable that this is happening right now. And I do hope that it turns around. With all the pushback that's already happened, I'm hopeful. I'm hopeful. But we need to increase testing sites in underserved and rural communities, period. And I'm going to show you right now. So don't be overwhelmed by this. I'm going to explain it. So here on the left, we have, this is Chicago. So these are all the zip codes in Chicago. And over here on the left, what we have is COVID-19 cases. So here in this area, this predominantly white, well-off area of Chicago, you see that there are very few cases. Then you start looking at these other zip codes that have these darker blue, higher rates of COVID in these zip codes. And then you look over here to the right, and what we see here is these, darker areas with low testing sites, low testing period. And then in the more affluent areas where you're seeing lower cases, it's easier to find a testing site. Interesting story, when I was on this webinar learning about this, it was an excellent webinar through the American Public Health Association. I was tweeting a little bit, and somebody actually reached out to me and said, Christie, I literally just rode my bike to go get tested. It took me an hour to get there. I had to wait in line for an hour and a half. And when I finally got to the people that are doing the testing, they told me that I couldn't be tested because I wasn't in a car. So he just wasted an entire day. And he said, well, I'm going to try and find a friend to take me tomorrow. But when you think about that, okay, well, if you're getting a friend to take you in their car, that's not social distancing. That's causing a number of other problems. What do we do about these people that don't have access to cars and transportation? And here we see, you know, we know that people probably in this part of Chicago, this more affluent area, have access to cars, where out here they're probably relying more on public transportation where they don't have these treatment centers. So we know, I'm using Chicago as an example, but we know that this is going on throughout the country. We know I'm from originally from the Finger Lakes region of New York State. And I know that people from where I live are having to go to parts of Rochester to get tested. And that's an hour and a half, 2-hour drive. And again, rural areas having to travel long distances to get testing is a deterrent to being tested. So this is definitely not, we're not just seeing this in Chicago. Chicago just gives us a very good example. So telehealth is something that I have also become quite passionate about following through COVID-19. And there are endless benefits. I want to start with the positive, right? It can save us time, and doctor's appointments cost us a lot of time in our lives. It can increase accessibility to care. It can save us money. We've been talking about transportation. It can help with transportation costs. And also, I think this is a really key point too. If we're relying on caregivers to take us to doctor's appointments, it can also have a huge and beneficial impact for caregivers. So there are many positives to telehealth. I actually also have an entire presentation on telehealth where I break down what you should know, how you should prepare. I go more in depth with the benefits, and I'm going to talk about the drawbacks right now, but it is an interesting topic. So the drawbacks are, oh no, that's my favorite slide. Go back. Okay, the benefits or drawbacks. I need more coffee. So not everyone is, first of all, comfortable talking to a computer or talking on their phone to their doctor. We just mentioned historical distrust. So people who are already a little hesitant to even go to a doctor in person, this doesn't help that problem. You know, like you're still going to feel intimidated. It's not like, oh yeah, now I can talk to them on the phone. That just makes it better. So that's also a concern. We also worry, and this is a big one, the digital divide. So we know that not everybody has access to the internet. Not everybody has a smartphone. These are realities. And oftentimes the people that don't have access to internet and the people that don't have access to smartphones are the ones that we need to reach the most. So these are certainly concerns around equity when it comes to telehealth. And there's one more problem, and it has to do with language. So if you don't speak English as your first language, or you don't speak English at all, getting on your phone, the systems that are being used for telehealth are not friendly to people who don't speak English as their first language, which just acts again as another barrier to care. So there are many equity, Nikki, you're like my soul sister. There are many things around equity and telehealth that we have to address. We need policy, we need support, we need funding. There are endless things that we need to address. We need translators. So yeah, there's a lot we need to work on. So this is, if you are on Instagram and you don't follow anybody else, follow Oh Happy Danny. She is doing such incredible work around racial justice, COVID. It's just incredible. And this is honestly my favorite slide of this whole presentation, simply because I think we all, like most of the people who are in my trainings, understand these concepts, right? It's just looking at it in a different way, offering some new perspective, offering some new insight. I love this as a teaching tool for people who might not, or having a hard time understanding how systemic racism is impacting COVID. So here we have the root cause. Here's the systemic racism. And then the trunk is these inequities that I've talked about. So we have mass incarceration that we talked about, overcrowding, more Black people than white people in prison, lack of access to healthcare, getting tested, which we just discussed, barriers to employment, needing PPE, educational disparities and access to resources, poverty rates, housing discrimination. So we see all of these things in this tree, right? And then on the outside, how all of these different factors are playing into increased risk of COVID infection. So I love this as a teaching tool. Yeah. Nikki, if you want to, you can take a screenshot or you can email me and I'm happy to send it to you. So thanks for asking. So I wanted to just say, we just talked about all these factors, right? So do we know this before COVID hit? Do we know that we were probably going to have a respiratory pandemic? Yes. Did we know the way that it would impact the most vulnerable people in our society before it hit? Yes. And this is proof. This is our concept model from H1N1 in 2008. And we knew that we saw different differences in social position based on all of the things that we've been talking about: income, wealth, health, education, race, ethnicity. We knew that it impacted the exposure. We knew that it impacted the susceptibility and treatment, and then how that led to these unequal levels of illness and death. We knew this a long time ago, but we didn't do anything to address it, to help us prepare for this, for what's happened in the last 6 months. And I can't believe it's been 6 months. So here are a few of the solutions. I am never one to just say, here are the problems, have fun. No. So what do we need? We need a number of things. We need to protect essential workers. We need to provide and make sure we have provided PPE, hazard pay, high quality healthcare. We want to make sure as well that those who are working on the front line, not just in medical centers, but all the people who are working in the front line, have first priority to a vaccine. We need to continue to help with the cost of living, suspending rent and mortgage, utility payments, healthcare, food, stipends. We know how necessary this is right now. And then last, but certainly not least, these are the short term. This is what we need to be doing right now to save so many people who are in just such horrible and vulnerable positions. We also need to address healthcare, what's going on with the education system, wages, and childcare. Absolutely, we need universal childcare. And that is more of a long-term goal, but we have to find some more short-term solution until that's available. So some of the more long-term goals, we really have to start to address racial bias and discrimination in healthcare, strengthening partnerships between communities, health departments, and healthcare systems, and also developing these plans that I'm talking about and that we'll talk about in part 2 of this presentation, is how do we look at planning through a health equity lens? How are we making sure that we are listening to and focusing on the people that we serve? And that is vital. So another quick poll, and feel free to write again in the chat. So So here's my poll. How well do you feel that your organization, wherever you work, was prepared for COVID? So how well do you feel they were prepared when, in March, they said, shut down the country? How do you feel like they were very prepared, somewhat prepared, or not at all? So I'll repeat. How well do you feel your organization was prepared for COVID? And do you think it was very well, somewhat, or not at all? Okay, great. So I see a few. Unprepared, pretty prepared, somewhat, very. That's great. I like seeing that. That's awesome. Okay, so I'll let you keep flowing them in. I'm gonna go to the next slide. So what we are going to talk about now is preparedness. So I know the focus of this session is really for nonprofits, and I just want to say that I think not sometimes. Before I was a consultant, I've worked for nonprofits most of my career, and I know that I know nonprofits and their staff are the first ones to be like, we got this. We got this under control. We're going to do what we have to do to serve the communities that we work with. Period. They make it happen no matter what it takes. And so many are also, especially when the first that comes to my mind is always the food banks given during COVID, right? Just the unbelievable amount of work that people are putting into making sure that people have access to food. So I just want to say thank you, because I think, just my opinion, that oftentimes there's just not enough gratitude towards all the hard work that nonprofit professionals and those on the front line are doing. So I want to just start by saying thank you. And yeah, community is strength. So what we're going to talk about for the next few minutes is nonprofit emergency business and volunteer plans. Now, some of you might have, there we go. Some of you might have these plans in place, but I think it's still good to revisit them, especially given the times we're living in. Nothing about COVID is stagnant, right? Nothing. So revisiting, okay, what have we done? What's really worked well? Like, oh, this was awesome. What isn't working well? And then how would we respond if X, Y, or Z happens? If we have another, I work in public health. I can't think of the word, but another spike. How are we going to handle it when a vaccine comes out? Like all of these different things that we want to be thinking about, right? So even if you have these in place, I think just a refresher and then I'm also going to end this with mentioning some ways to look at these plans in a more equitable way. So I'm going to go over the overview of each of these. So the emergency plan is to ensure that everyone knows how to keep themselves safe. The business plan, and I have a slide for each of these, is really time sensitive and critical, the process to keep the business running. And then the volunteer mobilization plan is exactly what it is. Do you need volunteers in a time of crisis? How do you mobilize them? How do you keep in contact with them? How do they keep in contact with you? So as we move forward through this, I just want to let you know that I have a handout for you, and it's in the session tab of the event. So I don't want this to be confusing. This is in the event page. So if you go to the event page, you can download it. And what I've done is I've created, I have links there so that you can go and look at examples and some outlines of emergency safety plans, business continuity plans. It's all there for you. So what I'm going to do is do a brief overview of each one of these, but then when you go to that resource that's already there for you, you can use that to help you and your organization move forward. So the emergency safety plan, every time I look at this, I'm like, this is like, as a business owner myself, this is like the stuff that you that you always have to do, but it's not the fun stuff, right? It's are the computers backed up? Do you have available off-site files of your computer? Do you have electronic copies of things if something was destroyed in a hurricane or fire? Where do people convene if there is a crisis during business hours? And I hate this example, but if there's, a tornado or there's a shooting or any of these things. So these are all things that you want to consider when you're thinking about your emergency safety plan. Where can staff get updates like after the event happens? Is there a plan for adjusted work hours? And so on. Another key piece, something to think about is, are there staff that are certified in CPR and first aid? And do other staff know that? So that's something to think about. And I think back to places I've worked, and I've worked in a few hospitals and health centers. So I didn't really worry about it so much then, but when I was in nonprofit, I didn't know if anybody had CPR or who did. And that's definitely something to think about. And also community outreach. So not just thinking about your staff, but also thinking about the people that you serve. So how would you connect with them? How do you communicate with all key stakeholders? And this could include board members as well. So keeping a list of different key contacts, making sure you have phone numbers and emails in a separate place so that those are safe and you can contact people when it's necessary. And really also just with the outreach plan, it's really important that we also consider how are you going to communicate with the most vulnerable who don't speak English as their first language? And I'm going to talk more about that when I talk about the equity piece in just a moment, but that's certainly something to consider. So the business continuity plan, identifying those critical operations that need to keep running, like payroll, like how do we keep that going? Identifying the first, the top 3 to 5 things that you need to do to keep surviving, including payroll, providing vital services to those most vulnerable clients, letting folks know about changes in services, and all of those things that are really vital to keeping you going. And think about, when you're planning, what would we need to accomplish within the first 24 to 48 hours? Which staff are critical? What are the delegation of tasks? And then, especially with COVID, how are you going to bring programs back? And I'm sure you've already started having these conversations and probably already putting them into action. So how do we do this safely? What is our timeline? What does this look like? And how do we let our community know this? So Ready Rating is one of the resources that I am providing you in that list. If you go to the session tab for this particular session where the download is, Ready Rating is really great. As you can even see here on just this small screenshot, they have participation, they have videos, they have PDFs, and also resources where you can fill in where you need to be. I also like it because there are also COVID specific recommendations in there, emergency planning, and just tons of endless resources here. It's a great place for you to just go and check it out if you haven't before. And then lastly, not everybody needs volunteers during pandemic. Again, I use the example of my local one is called Duchess Outreach, who offers food and has a soup kitchen, and So, what are the roles and responsibilities of the volunteers? What do you want them to do? Do you have a team leader on staff to make sure that the messaging going out is the same across the board, and they can help to coordinate the volunteers so that there's not misunderstandings and you're really making the most of volunteers' time? And then, of course, the logistics, organizing them and using them to the best of their ability, your ability. And just thinking really through, like, what roles will people play? How will you communicate? And all of those other things. So this is one of my favorite quotes. We're going to kind of talk about equity for a minute. Let me see what time it is. I'm in a hurry. Okay. So I want to make sure we have time for questions. So this quote, the route to achieving equity will not be accomplished through treating everyone equally. It will be achieved by treating everyone justly according to their circumstances. So I don't know if you've seen this before, but giving everyone a bike is not equitable. It's equal because everybody's getting a bike, so everybody gets a bike, but not the same bike works for everybody. So I love this graphic. I think it's super powerful and just shows us that we need to accommodate people where they are. So some insights: establish community forums and hear community concerns and needs, mobilize community assets, work together with other organizations, listen, truly listen to the people that you're serving and working for. These are some equity questions. Are there groups that you can build stronger relationships with? And this goes for both the people you're serving and community partners. Do people at your organization have relationships with communities of color? Have you invited key partners into your planning conversations? Whose basic needs are at risk of not being met? Do they trust you? It's huge. Is the information about your services accessible to the most vulnerable? And thinking about how to improve that. How do families work with does this make sense? How do families you work with want to receive communication? Yeah, this is key. So do they want emails? Maybe not. Text messages? Like, what works best for them? And do you know that? Do you have those answers? And have you heard it from if you heard it from them directly? And then lastly, do your board and staff represent the populations that you serve? And please, 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 I'm sure a lot of people here will, appreciate this, but don't tokenize. I get so tired of seeing boards who have one person of color and one woman and say that they are representative. No, you're not. You're not at all. So yeah, something to definitely be aware of and really think about. And then do you know how to reach your non-speaking English clients in times of a natural disaster? So I've given you these, if I had more time, I've done this presentation in the past and I had an hour and a half. And what we did is we would break up into groups and have this conversation in smaller groups. But I still think it's important to make sure that I give you these questions, and you can talk to your community partners, you can talk to your staff in-house. What are ways that your organization can be more equitable? Do you have staff that can spearhead these changes? And how will you continue to address preparedness through the COVID pandemic and beyond? So with that said, this is me. I'm just going to go to this slide. So I have two handouts for you, and I don't want this to be confusing, so I apologize. So I'm going to go through it. You have the preparedness handout, and that is on your session tab. So if you just go to the session, you should have that information right there for you. But then I also have a freebie for you. So the freebie is the list of discussion questions that I just discussed, and also the list of those equity questions. And if you're interested in getting those from me, you can go to howtotalktoyourdoctor.com /HCET. Feel free to take a screenshot. I am also on Instagram on How to Talk to Your Doctor, CVH Consulting. I do a lot of posting around everything I've talked about today. Or if you want to connect with me on LinkedIn. But I do recommend, I would love to stay in touch with you. I send out 2 mailings, newsletters a month. It's not like you're going to get email from me every single day. Oh, thanks, Doug. I appreciate it. So yeah, that's the link. And then feel free to connect with me. I'd love to continue this conversation. I would love to stay in touch with all of you. So feel free to stay in touch. And now I know I rushed through the end, but I always want to make sure that, and then you have the resources or feel free to reach out to me on LinkedIn or Instagram or something if that's helpful too. But I have a few minutes for questions if anybody wants to ask me any questions. And I just want to say thank you again for being here, and thank you for the Healthcare Education and Training and Wisconsin Reproductive Health Conference for having me.
Thanks, Christie.
I'm feeling better now, Nikki, but I'm still going to get that coffee. Thank you.
So we have a few minutes for some questions. So if anyone of the participants would like to enter a question in the chat, we will be happy to go through that. I do have a couple questions to get us started, Christie.
Yeah.
So what do you think should be the first step organizations take to address equity? So what do you?
So that's a great question. And it's always going to depend on your organization and where you are in this process, right? So everybody's probably at a different place. But what I do recommend is taking a look at, first of all, what you've done to listen to the community that you serve. So have you done focus groups? Have you done surveys? Are you having conversations? And really listening to their needs. And I've listed a number of them. You know, how do you reach them in time of crisis? We don't want to make assumptions, and we have to overcome those assumptions to make sure that we're providing equitable care and services. Mm-hmm. So that would be the first step, but also looking within your organization and how it runs and functions. As I mentioned a few minutes ago, looking at your board, all of these things matter. So that's why the list of questions can be helpful and just reflective, like, ooh, how are we handling this? And how are we handling that? So, yeah, that's the first. Look internally, as we all need to do with racism. And so, yeah, look, but also with organizations, start to look internally. What are we doing right? What could we really improve on?
Mm-hmm. Okay, I have another question. Do you think we will see long-term change in public health funding and preparedness as a result of COVID?
So I hope so.
Yeah. Right.
But I mean, I hope so. I feel like I could stop there, but I think in the short term we will. But the problem with public health is that when things are going right, it's typically not funded. We also live in what I like to refer to as a Band-Aid society. So, oh, COVID's here. We need to put a Band-Aid on it. We're not going to address these social determinants of health that have made it so much worse for vulnerable populations. So we have to start doing that. We have to take the Band-Aid off and start really digging deep. And I hope I hope we've learned that lesson, because as I mentioned, we've had other opportunities to learn these lessons and we haven't. So I hope this is the real kind of push that we need. If there's a silver lining in COVID, I hope that that's it, that we're really going to make these shifts and do better for society.
Yeah. Okay. Well, that's all the questions I have at the moment. Before we everyone jumps off, I did want to please ask you all the participants, please take 2 minutes, click on our evaluation link to evaluate this session. Your feedback is super important. This is the first time we've done a virtual conference. So if you could, I put the link in the evaluation link in the chat. If you could just take 2 minutes, tell us how we're doing on this breakout session and your other ones. It would be super, super helpful. So we really, really would appreciate that. And the evaluation links also on the session tab in the agenda as well, along with Christie's handouts. All right.
Awesome. Thank you, everyone, for having me.
So, okay.
If there's no other questions. And yeah,
No
please connect. I love, whatever way and feels comfortable, but I love staying in touch with participants. So I hope everyone has a great day and good luck with everything.
Yeah. All right. Thank you, everyone. Enjoy the rest of the conference. Take care.
Bye. Thank you.